Hi, good afternoon, Miss Peters. You can have a seat right here. I'm your nurse, Maurathan, and I'll be looking after you today. How are you feeling right now?
Not too good. For the past 5 days, I haven't felt good since I last visited the doctor.
Okay, so tell me more about how it's different from your last visit and tell me more about your symptoms.
So these past few days, I've been experiencing chest pain that worsens whenever I cough or breathe. And I've been feeling weak, and yesterday I have developed a fever.
I see. So I'm going to ask a few more questions so that I won't miss any key information. Is that okay with you?
Yes, that's okay.
So I know that you've been experiencing this for a couple of days now. Have your symptoms worsened and how?
It's worsening. So I checked my temperature at home, and it was 38.9 degrees Celsius. When I cough, my mucus is rust in color and it's really thick. When I cough, my chest hurts a lot, and sometimes I get chills too. But at the end of the day, I'm really exhausted.
Can see why there's a problem there, but don't worry, we'll look into it. But does anything appear to improve the symptoms?
I took Tylenol because I just thought I had the flu.
Oh, I know that a lot of drugs are available over the counter, like Tylenol, and everyone makes the common mistake of thinking it is safe, but it doesn't mean it is safe for everybody. It is important to use the resources to make the right choices, like the pharmacist, who can answer your questions about medications for the following symptoms that you feel.
You're right. I should have come back to see the doctor right away when I felt that I wasn't getting any better.
Looking from what you have told me so far, we'll be performing a chest x-ray, blood test, and a sputum test. It seems that you're showing signs and symptoms of pneumonia, but don't be scared, it is curable and it's common among your age group. So these test results will confirm it or not.
So what do I need to do now?
Firstly, do you know what pneumonia is?
I only know that it is a lung infection.
You're right, pneumonia is a lung infection where the lungs' air sacs become inflamed, making it harder for you to breathe. These air sacs may also be filled with fluid or pus, and it can be caused by virus, fungi, or bacteria, and bacterial pneumonia is most common among your age group.
Okay, I understand.
It's just like an ordinary cough and fever. Patients with pneumonia usually have symptoms including sudden onset of fever, chills, productive cough with sputum, and chest pain. However, pneumonia can become very severe when no intervention or care is done, so treating patients with pneumonia is necessary to prevent it spreads to others.
So nurse, how is pneumonia treated?
Treatments of pneumonia depend on its cause, how sick you are, your age, and your overall health. Your doctor will prescribe an antibiotic after the lab results confirm that you have pneumonia. You may also receive medication to loosen up the mucus in your lungs and medication like Tylenol that you already have at home to reduce your fever and discomfort. But if you're having a lot of trouble breathing, you may be admitted to the hospital for oxygen therapy until you get better.
But what do I do if I don't feel any better?
Well, you should start to feel better within 2 to 3 days after starting your treatment, which is your antibiotics. You need to take the entire course of this medication and follow the doctor's instruction. But if you have severe cough, trouble breathing, or fever, it is important to call your healthcare provider. And at your local pharmacy, you can get this thermal scan. So you just have to put on this cover,
Okay.
pull your peanut up and back, and insert it, and press the start button. You'll hear a beep, and you'll show your temperature reading. If the temperature reading is above 38, and you should go see your doctor.
Okay, I understand. But are there any additional things that I can do to make sure I'm going to recover from this?
That's a great question. So first, you need to get plenty of rest because sleep is important to maintain progress towards full recovery, and you want to avoid relapse.
I see.
Great. You also need to drink lots of fluids to keep you hydrated and help loosen mucus in the lungs.
I understand.
And you need to eat well-balanced meals even though you have poor appetite in order to restore your health, your body's health. Here's a pamphlet of a nutrition guide. It can help you when you're preparing your future meals. You can have a look at that.
Okay.
It is also important to wash your hands with soap and water, and you can also use an alcohol-based hand sanitizer after blowing your nose, using the washroom, and before eating. The hands come in daily contact with germs that can cause pneumonia. These germs enters one's body when you touch your eyes or rub your nose. Washing your hands thoroughly and often can help reduce the risk, and you want to make sure you get under your nail beds. And then here's an easy 6-step way to wash your hands properly. So you can keep this at your washroom or in the kitchen and follow these steps when you wash your hands.
Okay.
And I also encourage you to cough and do deep breathing to maximize gas exchange and to clear the phlegm.
I'll definitely do that.
Lastly, do you live with anyone?
I live with my husband, and my children visit me twice a week.
So in order to protect those around you, you can protect them by wearing a face mask and always cough into a tissue.
Okay, I'm happy that I made the right choice of coming here today.
Perfect. Do you have any other questions so far?
No, I don't. This is so helpful.
I'm glad to hear that, but I just want to remind you that in order to make sure you're getting better, you need to contact your healthcare provider in 2 days to share how you're feeling. Never stop the medication as prescribed if the symptoms have improved in order to prevent your pneumonia to reoccur. Also keep all of the following appointments. You'll normally see your doctor in 2 to 3 weeks for a follow-up, and expect to get another chest x-ray in 4 to 6 weeks to make sure the pneumonia is gone.
Okay, I'll make sure to do that. Thank you.
You're welcome, Ms. Peters. Nice to meet you, but don't hesitate to call whenever you feel that you're not getting better.